Hi everyone, I am Dr. Gloria. Welcome to Ask Dr. Gloria channel, where health and wellness are made simple and easy to understand. Learn smart, live well. That is our logo here. Don't forget to like, subscribe, and share your health and wellness questions or topics you would like us to discuss in future. I'm happy to help. Let's dive in on what we have today. The quiz we have here contains multiple choice questions from different academic and competitive exams. You have 5 seconds to answer each question. Pause the video if needed. I'll try to pause the video as much as I can. The question we have here today is about food parasitology. So, test your IQ on how well you know food parasitology. These are MCQ questions. Question 1. Which parasite causes prolonged watery diarrhea and is particularly dangerous in immunocompromised individuals? C. Question 2. Eating raw or undercooked beef is a major risk factor for infection with which tapeworm? C. Question 3. Which parasite is transmitted through cat feces and may cause severe complications during pregnancy? C. Question 4. Toxoplasma gondii infection can be prevented by C. Question 5. Matching kind of question. So, as health professional, as health student, as medical student, or any department you're from, familiarize yourself with different kind of questions, whether it's essay, whether it's like theory kind of question, matching kind of question, fill in the gap, any kind of question. So we have a matching kind of question here. It says, match each parasite with its primary foodborne source. C. Question 6. A sushi-loving tourist develops gastrointestinal symptoms for 4 weeks after returning from Southeast Asia. Which fish-borne parasite is most likely responsible? This is like a clinical question scenario. C. From the option, there is a hint there which says the fish flock. You may not see the fish flock actually, but you should know the Opisthotria. You should know that. Question 7. Question 7 says, Cristoporidium parvum oocysts are particularly problematic in water treatment because B. Question, there is an exam tip here, right here. I put a not the crypto, not the digital digital currency, by the way. So, crypto is resistant to chlorine. I put a 1 is signs here. So, only removed by filtration. And always know that these are the immunocompromised patients are at high risk for this kind of parasites. Question 8. Trichinella spiralis infection is primarily acquired by consuming B. Question 9. Cyclopro Parachitinances is most commonly associated with outbreak linked to which food vehicle? B. B. We have question 11. Question 11 says, a traveler returned from a camp trip and reports bloating, flatness, and foul-smelling greasy stool for 3 weeks. The most likely parasite cause is B. Question 12. Ascaris lumbricoides, the giant intestinal roundworm, is primarily acquired through B. Question 13. Which of the following is a severe complication of Taenia solium infection that involve larvae migrating to the brain? C. I put a mnemonic right here, the Taenia solium, which is the pork tapeworm. Okay? If their egg, which is the cystic serosis, if the egg migrates, if the egg is injected, these can migrate to the brain. So cook pork thoroughly if you need to eat them. Question 14. The most effective method to eliminate protozoa parasites such as the Cryptoporidium and Gardia lambias from drinking water is A. Question 15. In an immunocompetent adult, primary toxoplasma gondii infection most commonly presents as B. Question 16. Which of the following is the most comprehensive preventive strategy against foodborne parasite infection? C. Question 17. What is the key biological differences between protozoa parasites and helmintic parasites in food microbiology? B. Thank you so much if you've listened to this time. Until next time, I remain Dr. Gloria. Don't forget to like and subscribe and put down your questions you'd like us to discuss about. Have a nice day, everyone.